Hello, everybody. My name is Marty Hatley. I'm the president of Project Patient Care, which is a Chicago-based nonprofit organization that is dedicated to including the voice of the patient in quality and safety improvement work. We're here today to look at the impact of the COVID-19 pandemic in the long-term care community with a focus on nursing homes. We'll explore how things have changed for residents of nursing homes, for their family members who often can't visit them, and for the people who work in nursing homes and post-acute care nursing homes. This is part of a series that Project Patient Care is doing with a number of partners to really look at how this pandemic is affecting multiple dimensions of healthcare as we know it now. So my first guest today is my colleague, Pat Merriweather-Argis, who is the Executive Director of Project Patient Care. Pat has been extremely active during the pandemic in staying on top of the best information available about what's happening in nursing homes and what we can do to keep residents safe overall, as well as to manage the risks associated with COVID for both residents and staff. Welcome, Pat. Will you start by telling us a little bit about you and why you're so interested in challenges that the long-term care community is facing now?
Thank you, Marty. I'm interested in the challenges that the long-term care, especially the nursing homes, are facing, is because I've seen the mortality rates, I've seen the infection rates, and I know how hard many nursing homes are working to reduce them, but they just don't have the resources available. Nursing homes have always been an interest for me. When I was in 8th grade, we had to do service projects, and I was assigned to Little Sisters of the Poor, nursing home in Chicago. And I saw the compassion that they treated all the residents with and just the living environment they were in and how it was about living, even though some of them may have been in hospice. Again, it was the humanity that really shone through at the nursing home. And that's sometimes not what I see when I visit different nursing homes.
Pat, will you say more about the living and working conditions that we're seeing in long-term care now? What are your concerns for residents and for the staff working there?
I think it's a very challenging time right now in nursing homes with the living and working conditions. And I'll talk about the residents first and then the staff, and not that they're in any order, because they're both very important to nursing homes. And in terms of the living conditions for nursing home residents, they're on lockdown. They've been on lockdown since March 13th, which means it's about 100 days. Lockdown means they don't have within the nursing home visitors, friends, family, chaplains, volunteers. It's strictly the staff that need to be there, the essential staff. So you can imagine with that type of setting that they are restricted in their movement. They have to wear masks. They can only be in certain locations. They have, almost all of them have their meals in the same room. Breakfast, lunch, and dinner in their room, not in a room with other people. And so now get a sense of if you were confined for 100 plus days in a room and you were having your meals there and not having much conversation with anyone because everyone that is there is so busy. So you start feeling isolated, depressed. You may also start having some challenges with physical mobility because you're not able to get around and walk. And so we're seeing that the conditions of the nursing home residents are changing physically and emotionally and psychologically. Now, for staff that are working there, they just pray they have enough personal protective equipment to make it through the day and the weeks ahead. And it's not always the case. They also are dealing with testing kits, having availability of testing kits, testing the nursing home residents, but also making sure that they're tested. They go through testing every time they come in the nursing home. They're checking their temperature and filling out forms that they have been in contact with anyone with COVID-19, they don't have the symptoms. And so the working conditions, if you can imagine, wearing the gowns, the masks, sometimes the face guards, the gloves, it's a very challenging and stressful time period. Nursing homes, a quarter of them in Illinois have said they don't have enough aides. Some of them don't have, 20% don't have enough nurses. And some of it is due to, one, they've developed COVID-19 and they can't be working, they're symptomatic. Two, they're concerned because they have families. They're going home to loved ones and they're concerned about not only their health, but the health of their loved ones. So you have more stress on staff than you ever had before. And I'll talk about Illinois because Illinois, we had shortages of staffing to begin with, and that's only more pronounced right now. And so the staff are challenged, and now in Illinois, residents can have visitors outside. It's got to be through a very controlled process. You can request a visit. The nursing home, they can decide if they have enough staff to support it. A staff person has to be with them at all times. They've got to wear the mask. They've got to keep the social distance. And again, and then they have to check the visitors to make sure that they don't have COVID symptoms and they don't have fevers. So the work that's involved in just having that one visit is tremendous, and it puts more strain on staff. And yet at the same time, it's really helping the residents to have that type of experience with a family or a loved one. So it's very much a challenge right now, all around.
Pat, I've heard you speak of this as a humanitarian crisis, what's happening in our nursing homes now. Given just the extent of the problem, why do you think we're not seeing more media attention to this issue?
I wish we had more concern about what is going on with nursing home residents. In Illinois, 55% of all the COVID-19 deaths in Illinois are nursing home residents. In many states, they're hovering around 40, 30%. Up if you go in New York and some of the eastern states, they're at 80%. Canada is at 81% of all COVID-19 deaths are nursing home residents. And yet they make up less than 1% of the population, about 0.4% of the population. I mean, that's just a tremendous statistic to think about. I just feel that it's out of sight, out of mind. And I think it's because the nursing homes, unlike the hospitals where they have more open doors, nursing homes don't have open doors. And I think if they had, like hospitals have, the patient family advisory councils and more structure around having the community involved, community engagement, community assessments. I think if the community was more involved and engaged, I don't think we'd be having some of these issues.
Thank you, Pat. Can you tell us a little bit about what federal and state agencies are doing to address the crisis?
To be honest, I think it's a scattergram approach. I don't think there is any cohesive approach that's being done. The federal government recently came out with statistics on Medicare beneficiaries, and never once did they mention about the nursing home residents or the deaths of nursing home residents in the statistics, which was just startling to me. In terms of the states, we're all fending for themselves, trying to work through it. It's surprising to me that the alarms weren't going off in Kirkland when Kirkland had their deaths. Again, it was the perfect storm. You have patients with comorbidities, the complications, in congregate housing, elderly, all the conditions that they said were ripe for COVID-19 infections. Many of the states started collecting data because they needed their own data. Recently, the federal government, through CMS and the Centers for Disease Control, collect their own information from all the nursing homes, and it's actually more robust. And that statistic I provided in terms of what percent of nursing homes don't have enough aid or PPE, that's all available in there. Now it's, what are we going to do to act on that? Why is it that we still have nursing homes that don't have enough gloves, that don't have gowns? Sometimes they're using garbage bags or any ponchos or anything they can find. The masks, the surgical masks. I see everyone outside with surgical masks, and yet we have nursing homes that are begging for surgical masks. So I think there's really not a good solution that I'm seeing in states or in the federal government. And I think they need to work together. They need to put the emphasis on the nursing home resident and not on their own initiatives, but coming together with best solutions. I know there was a document that was produced on best solutions for 50 states, and I went through it, and I'll tell you, it's really not best solutions, it's just what they're doing. So again, until the numbers go down, and the scary thing is in Illinois, 4% of all of the residents have died of COVID-19. So again, I think we need to really move quickly. We're way behind, and I just don't think there's enough coordinated activity going on.
Pat, will you also speak to what the private sector is doing? I know you're very active in Rotary, and that Rotary has really stepped up in Chicagoland. Is private sector stepping into the gulf that you're seeing?
I think in different locations, the private sector is stepping in. I know with Rotary in the Chicagoland area, we've purchased about 250 iPads that are going to safety net hospitals and nursing homes so that they can use for telehealth as well as for communicating with their loved ones. We also sent out a request to everyone in all the 12,000 Rotarians in Illinois that they check in on their local nursing homes, that they make it a point to see if they need anything, call the administrator. When I say check in, it doesn't mean going there because you can't get in, but making a call there and saying, what can we do to help you? Is there anything you need? What does the staff need? What do the residents need? So I think it's that approach, but if it's silent in the media and it's silent at the federal level, it's not getting the attention that it needs.
Thank you, Pat. It's inspiring to hear what you and the Rotarians are doing out there. It just makes me feel great about the fact that there are good people in the world that step up in situations like this. But let's shift now to if you are a family member and you've got somebody who you love who's in a long-term care facility, what are the best sources of information for family members who are concerned about their loved ones?
First of all, it is now a federal requirement that nursing homes provide information to families and loved ones. Before, it was an option. You didn't need to provide the information to the nursing home resident that they were tested positive with COVID-19. You didn't need to provide it to the family member, and you didn't need to have that information available. Now you have to. You're required by the law by the executive order to make sure that residents do have access to their test results. The family members are notified of the test results, and it's made known through the staff. That's the other thing, is the staff weren't even aware if somebody tested positive. So there's many things that have changed to help get that information out. Now, in terms of, it's very difficult to read the federal report that's available. It's in a data format. I use it all the time, but again, you've got to be able to use and manipulate some data. But in many states, they do have that information available. In Illinois, the information is available. It's updated weekly, and it tells you the number of confirmed cases at a nursing home, as well as the number of deaths. And so that gives you some information. The challenge is if you're looking for a nursing home, maybe you have a loved one that needs to go into a nursing home, or if they're in an area where they're doing elective surgeries and they need post-acute care, the best thing is to contact the facility, find out through word of mouth anything going on, as well as if you can get somebody to manipulate that data so they can give it to you. But you can't make a visit. That's the one thing, is you can't visit a nursing home to see if you're placing or you need a place for somebody to go. You can't visit them right now. You can only call them, and again, rely on resources that are out there. But certainly word of mouth, just Googling on the internet, sometimes there's a lot of things out there.
Thanks, Pat. As we wrap up here, I'd like to just get your best advice. So what is your best advice for family members who are worried about someone in the organization? And can you also give us any advice or words of wisdom you have for the staff working in organizations if they feel the conditions are unsafe? What should they do?
For family members wanting to visit loved ones, I know that many nursing homes are working on so many different types of accommodations. I've heard of one nursing home that it doesn't matter if they're in a wheelchair, if they're confined to bed. They're finding a way to wheel them to a window, near a window, so they can see a loved one, usually on the first floor of a facility. Some are opening up, they have screens and people are communicating through screens. I would, if anyone's in a nursing home, I would make sure that they have an iPad and the ability to charge that iPad so they can communicate face to face with the loved one. It's great talking on the phone, but I think as we all have been on Zoom for a while, using Zoom to communicate, everyone still wants to be able to see somebody, get that reaction, to get that image, that face. So again, I think don't stop doing what you're doing. Letters, cards, sending everything that you can think of to remind them that they're still being thought of, and making that communication with the staff person who empathizes with the situation you're in, that you'd love to be able to see a family member, but at this time can't, and how they can help accommodate them. Many are working out schedules so that if they have the iPads, they have scheduled times in which the resident and the family are communicating. And that way, again, it doesn't take any technology knowledge on the part of the resident. It's all set up by the staff there. So it does help. It does help to alleviate some of that isolation and just depression that's occurring in nursing home residents. Now, in terms of staff working, if they see something, I think we all hear the saying, if you see something, say something. Everyone has an obligation to talk up if there are unsafe conditions. Unsafe conditions do include not having enough personal protective equipment. I think that's essential. I used to work for the fire department. I can't imagine somebody running into a firefighter running into a building without having the equipment. It just doesn't happen. And so I think we need to regard the nursing home staff in the same way as we do any type of frontline healthcare worker. They are dealing with residents that have COVID-19. They are also in very challenging conditions. So they need to speak up, and they can speak up through their Department of Public Health. Some have used their unions to work through issues. Others have taken to media. But I think you want to work within your organization, but certainly if there's a deaf ear to what's being said, somebody needs to speak up outside of that. And if you see harm occurring, and that was one thing, is the spread of COVID-19, just like the spread of any infection in a nursing home, spreads like wildfire. And so containment early on. And if you don't have the knowledge to how to stop it, you need to speak up. And I would even, and not to put hospitals on the spot, but I would even call a hospital, because I think they would step up and say, here's what you should be doing, and probably giving them more guidance than they anticipate. So it's great to have IDPH or the QIO to help, but they're very short-staffed. But there's, as I say in Illinois, there's about 730 nursing homes and about 200 hospitals versus a handful of staff at public health or a handful of staff at the QIO. Lean on your hospitals. I think they are more than willing to help.
Thanks, Pat, for your insights, your care, your information, and your practical advice. I'm sure it's going to be helpful to many people who see this, who are either a worker in that setting or have a loved one in that setting. And I really appreciate the work you're doing and your time with us today.
Thank you, Marty. Thank you to all the nursing home healthcare workers that are out there. And thank you to all the loved ones that are really making an effort to care for their loved ones and the communities that surround them.